Hey, I'm Dr. Joe, and I am to LoveThatFace.com, and today we're going to talk about treating patients that have excessive nasal flare. And this is something that we all can flare our nostrils, but some people they flare excessively when they talk or when they animate or when they laugh, and it's bothersome to them. And we can use neurotoxins to change this. So we're going to do a little anatomy now and just show you kind of some of the muscles that we're going to treat. So the nasalis muscle is big muscle here, and that compresses the alar cartilages. And try and scrunch up once for me. And then it connects, all these muscles are interconnected, and our procerus is up here when we treat those areas. And there's also a transverse or alar part of the nasalis muscle. Okay. And then there's the dilator nares, and that's what opens our nostrils right there. And so you also have depressor septae, which pulls down the nasal tip, and then you have the orbicularis muscle of the lip. So all these muscles act in harmony to do different things here. You try and raise your nose once. Yeah. So, and we commonly treat the bunny lines. And so what we're going to do is we're going to treat all this, and I'm just going to explain how we do it. All right, so dilate your nostrils for me. All right, so you can see she's depressing with the nasalis, and she's dilating with the dilator nares. Go on, do it again. All right, so relax now. So I happen to be using Botox here. It doesn't matter what you're using, and I'll put probably 2 units here. And go ahead and do it again. And I'm going to put a little bit here in the lateral nasalis. Do it again. All right, and you can see how that really tips her whole nostril posteriorly. Do it again. Okay. And if we're going to incorporate the bunny lines here, crunch up your nose for me. Okay, so we're going to treat the nasalis here, lateral, and come around here. I'm going to treat a little bit there. Scrunch your nose up and a little bit in the anterior part of the nasalis. And then we can get up here into the procerus, which we're usually doing when we do our scowling treatment. So this whole combination ought to make a big difference in her bunny lines, but really we're doing it for the dilator. So we'll come back and follow that up.
Hi, Dr. and I am too. I promised you an update on my flaring nostrils and that stupid human trick that I used to be able to do and flare my nostrils to the beat of any song on the radio. I can't do it anymore. Here's my best shot. Can't do it. It's much better. Thank you.
These muscles serve a purpose, okay? They dilate our nostrils to help us breathe. So the anterior muscle works frequently. And, if you're running or if you're out of breath or something like that, you look in the mirror, you watch athletes, I'm dilating mine right now trying to show you, but they dilate their nostril, and that helps bring in more air. The posterior, the nasalis muscle, does serve as a dilator, but you don't usually see that unless people are in respiratory distress, where they're having a hard time breathing, they can't get enough air in, and then that muscle kicks in too, and both those muscles help expand or dilate the nostril. So my friend here, like other patients that we have, when she talks or smiles or laughs, her nostrils get big. Okay, so cosmetically, people just don't like that, and what we're going to do is put about 2 units in each nasalis muscle, and usually that's enough. What we do is, with all our neurotoxin treatments, and again, you could use any of the neurotoxins for this, not just Botox, we'll treat it, and then we'll ask the patient to come back in 2 weeks if it didn't do what we wanted to do. So we will show you how we do this. Okay, so we're going to inject the nasalis, and if she had I'm sorry, we're going to inject the dilator nares. If she had an extreme amount of flaring, we can inject the nasalis too, which I may do anyhow for her. And can you flare your nostrils once? There you go. Do it again. Just do it a couple times. I can see it. I'm not sure if they can or not. And we're going to use Botox here. We could use Dysport, Xeomin, any of the Jeuveau, any of the approved neurotoxins. And I always, when I'm doing small injections, like several units, I always want to make sure my needle is purged. And like the same thing with lip lines. You know, you don't, sometimes on a syringe you can press and nothing happens and then it goes away from you and you get a big old injection volume. So I kind of almost like to tap on the syringe when I do these smaller injections. So we're going to just go here into the muscle, which is kind of subcutaneous. There's not a lot there. And that's 2 units. We'll come to the other side here. Okay, and if we were going to do the nasalis, we're going to just go up here on the side of the nose. We're the same way kind of where we treat bunny lines, but I'm going to do it a little bit lower here. And so it's a pretty simple treatment, and that's how we do it. Flare your nose for me once. Okay, very good. So that's how we treat nasal flaring with neurotoxin. I'm Dr. Joe, and I am to lovethatface.com.